I am Dr. Larry Alexander, and you've taken the first big step towards caring for your eyes. An eye examination is more than just a pair of glasses. It is about eye health and preventing unnecessary loss of vision and life. The world is experiencing an epidemic of diabetes at this time. It's estimated that currently 1 in 10 U.S. adults have diabetes, and by 2050 it could be upwards of 20 to 33% of U.S. adults. By definition, diabetes represents the body's inability to properly metabolize or use glucose, which then creates the changes in tissue and organs. Those changes include a breakdown of the tissue in the eyes, which can then lead to loss of vision. Diabetes is the leading cause of new cases of blindness among adults aged 20 to 74. Up to 74% of persons who have diabetes for 10 years or more will develop some sort of eye disease. Diabetes affects millions, and the cost of diabetes to the healthcare system is in the hundreds of millions of dollars. Diabetes is usually categorized into insulin-dependent and non-insulin-dependent, but this is way oversimplified. The disease is very complex and requires a lot of discipline by the patient and provision of care by doctors dedicated to understanding the disorder. There's a hereditary factor in the development of diabetes. That is the uncontrollable factor. Risk factors that contribute to most systemic disorders likewise increase the risk for development of diabetes, including your diet, your weight, your commitment to exercise, and smoking, just to mention a few. Control of your lifestyle will decrease your risk of both diabetes and vision loss. As a patient, you need to take care of yourself. Since diabetes affects tissue and is also a multi-organ disease, it takes a team approach with diligent communication amongst the team to properly manage you as a patient. Your eye doctor uses the observation of the inside of your eyes coupled with very sophisticated diagnostic tests to determine the early diagnosis of eye complications of diabetes. There are multiple ways to control the outcome of this disorder. Diabetic eye disease does not have to equal blindness if caught in time and properly managed. Thank you for your attention today. Please take a moment to click the appointment button on this page to take your next step to having the best vision possible for many years to come. It may be the best decision you make today.